At the end of the week, we had a diagnosis, Pompe disease.
Muscle weakness, difficulty breathing, sleepless nights. Are these symptoms of a serious illness or just a variety of minor problems? Could you make the diagnosis? Hi, I'm Erica Vitrini, and I am delighted to welcome you to Access Health. The symptoms can be subtle, but the results can be devastating. On today's show, we're spotlighting patients with Pompe, an extremely rare and inherited neuromuscular disorder, and the difficult journey these patients take to get a diagnosis. With me is our team of specialists. First up, he's the distinguished researcher and surgeon, Dr. Dennis Holmes. Next, she's our certified nutritional expert, Janet Zapala. And finally, when he's not at the gym, he's running circles around our studio, fitness guru, Dave Sinclair. We've got a great show ahead of us, ready to create some awareness.
For sure.
Dave, we're going to start with you real quick. Aches and pains, muscle soreness, sort of what you would expect when you're getting stronger sometimes, but sometimes it means something more.
Yeah, I say listen to your body. And if your intuition tells you that it might be something else, it might be something else.
The same can happen with food. If you don't eat well for a few days, you miss a few meals, you don't have that energy, you think, well, that's the reason why. So if something's a little askew, it bears looking into.
Doctors love solving medical mysteries, but sometimes even the best of us are stumped by patients with simple symptoms that you just can't tie together for an explanation. Maybe it's a good time to consider having a second opinion, or maybe even a third.
Well, this is exactly what folks suffering from Pompe disease are dealing with. They go to the physicians with a whole set of symptoms that can be indicative of a number of different diseases. But why is Pompe so hard to diagnose? And what's being done to shed light on this disease? Up next on Access Health.
If you have certain medical conditions, or if you just haven't exercised in a very long time, we've got some great movements here to increase your muscle strength and just make your body perform better. And the best part is we can do all of these in the comfort of our own home. So it's just very simple, basic, but extremely effective stuff. Now, before you do any of these exercises, whether they're muscular strength training exercises or stretching or any type of exercise, consult with your physician or your therapist. That's very important.
One of the greatest privileges of doing a network television health show undoubtedly is getting the word out. And here at Access Health, we get to raise awareness about so many important health topics, including awareness of rare diseases.
Having an undiagnosed, unexplained condition is one of the most difficult situations that a patient and doctor can go through. That's why it's always our pleasure and really a thrill here on Access Health to be able to crack the case of this medical mystery.
And joining us to explain one such medical mystery is Dr. Barry Byrne, rare disease specialist and director of the University of Florida Powell Gene Therapy Center. Dr. Byrne, it is such a pleasure to have you here on our show.
Eric, I'm glad to be here.
Welcome to the show.
Thank you.
And so you're here today to spread awareness about a rare disease, one that is notorious for eluding a proper medical diagnosis for sometimes decades. It's called Pompe disease, and it is very serious, highlighting the need for early diagnosis. So tell us, doctor, what exactly is Pompe disease?
Pompe disease is a form of muscular dystrophy, which is mostly dominated by weakness, and patients can develop this weakness at any age.
So I understand this is an inherited condition, but can you explain the genetic basis behind it?
When a parent carries one of the defects in the gene for Pompe, it can be passed on to the children, and in a proportion of the children.
In either parent?
Both parents have to be carriers in order for the child to be affected.
That parent may not know because having one gene, they may not have any of the symptoms.
Correct. So all carriers are asymptomatic, like those that have no carrier status. It's really not detectable in the carrier at all.
When do these symptoms start to show themselves? At what age?
All age groups can be affected. There's no preference for men or women. The onset of the symptoms is related to the severity of the problem in the gene. So those with the most severe problems in the gene are detected early, and those with milder problems have more delayed symptoms and a slower rate of accumulating those problems.
Now, someone with, say, an adult onset of this disease, when would they expect to see symptoms?
Patients often present into the third or fourth decade of life, but when they think back into their childhood, there's many times evidence earlier, sometimes more than 10 years earlier.
Could you tell us what kind of symptoms doctors and patients should look for?
Well, as with many patients with weakness, they can have difficulty walking, climbing stairs, or getting up from a chair. But one of the earliest problems patients experience is difficulty with breathing at night. Those nighttime breathing problems can lead to daytime sleepiness, morning headache. But when you put together the problems of weakness that does impact function and the sleeping problems, that's when people should start to think of this difficulty.
I'm thinking, are there any tests? Can I go someplace to get sort of a proper, something that tells me for sure?
So one of the common screening tests for liver function can be elevated in Pompe disease. The transaminases are a liver enzyme that are also present in muscle. So when muscle disease is present, the transaminases are also elevated, but to a milder degree.
How rare is this disease?
Among the muscle diseases, Pompe disease really has a very similar frequency to other neuromuscular conditions that lead to weakness.
Doctor, thank you so much for making us more aware. I know you're joining us later in the show to talk about Pompe resources and advocacy, which I know you're very passionate about. And we also are going to hear some personal diagnosis stories from people living with Pompe disease. But in the meantime, you can log on to accesshealth.tv for more great educational information about Pompe facts and symptoms. We'll be back with more Access Health in just a bit.
Today we're on location at the beautiful JW Marriott San Antonio Hill Country Resort and Spa to spend time with two very special people, Tiffany and David, who have been profoundly affected by Pompe disease. Tiffany, so happy to have you on the show.
Thank you for having me.
Pompe disease occurs in about 1 out of every 40,000 Americans. I understand in your own experience, you went about 10 years before you arrived at a correct diagnosis.
That's right.
What were your initial symptoms and what did your family and doctors think about them?
Really, my first symptoms started when I was an infant. For as long as I can remember, I always had a cold. Instead of being sick for a few days or a week, I'd be sick for a month or two. And my parents kind of thought, this isn't right. We'd go to pediatricians and get referred to specialists, and the answer they kept being given was, well, it's normal for her. And that went on until I was 11. At that point, my dad's cousin was in town. He was a pediatrician, and my parents shared their concerns. And he said, no, you know what, you're right. She has some sort of myopathy. I don't know what it is, but you're right, there's something not right here.
How did your parents and you arrive at a diagnosis?
He suggested I get tested as soon as possible and look for a diagnosis within the muscular dystrophy field. I'll get you an appointment up here at the Mayo Clinic, and we spent a week up there running through any tests you could think of, and at the end of the week, we had a diagnosis.
Pompe disease.
Pompe disease.
Did they give you an idea of the prognosis at that point?
I know they told my mom that the prognosis was she'd live to her second decade.
That must have been a rather difficult pill to swallow as an 11-year-old being told that she might not live to 20.
Yeah, it was, and honestly, in some ways it wasn't, because my parents didn't ever really listen to that, I guess. And so it was, kind of a possibility, but it wasn't a certainty.
Well, how old are you now?
32.
You're definitely proving the original doctor wrong when he or she suggested that you only had perhaps until 20. What management options did they have for you at that time?
In '95, there were really none. There was some research being done and some suggestion that diet and exercise might help. And I tried it for many years. It didn't work for me.
Now, I understand a few years later there was a clinical trial that you became involved with,
Yes.
which did offer you some alternative approaches.
Yes.
And here you are, now with your law degree, I understand.
Yes, I completed my law degree in 2011.
I understand that you're also the president of the AMDA, as well as the chairperson of the International pom-PAY Association.
The AMDA, it's also known as the Acid Maltase Deficiency Association. Right around the time I was diagnosed, 95, my parents actually started our organization. A big component is patient advocacy, patient support, but especially in the early days, promoting research was a huge component of what the AMDA did.
Now, I understand April 15th is an important day in the pom-PAY community.
It is International Pompe Day. It was the day that Dr. J.C. Pompe was actually killed. And J.C. Pompe is the man who discovered Pompe disease back in 1932. He was actually in the Dutch resistance. We chose April 15th because it represented fighting against adversity and continuing to pursue what you believe is right, just continuing to fight the fight. I'm also the chair of the International Pompe Association. For the IPA, one of the main initiatives is to promote and support better disease management across the globe.
If you'd like to tell the world one thing, what would it be?
Be your own advocate. If you think that there's something wrong, don't stop looking for answers.
I greatly appreciate you sharing your message and joining us on Access Health to talk about this important but uncommon condition.
Thank you so much for having me.
For more information about the AMDA and Pompe disease, please visit our website at accesshealth.tv. I'm now with David Hamlin, founder of the United Pompe Foundation, patient advocate, and father of Eric, a young man living with Pompe disease. David, so great to have you on the show.
Thank you for having me.
Tell me about Eric and the road that led to his diagnosis.
Eric is now 27 years old. When Eric was about three and a half years old, he was diagnosed with Pompe disease, which was kind of a total shock for us. When Eric was first born, everything seemed normal. When he had his first year checkup, they did the blood work and everything, and we got a call from the doctor that there was something abnormal with the blood test. We found out later there was actually notes put in the chart that he had head lag and leg muscle weakness, but it was never told to us. Eric was slow reaching some of his milestones. He didn't walk until the day before he turned 2. And when he did start walking, we noticed he walked on his tiptoes. My wife always thought that there was something not quite right. A couple years later, I had gotten in an automobile accident, and I was on a follow-up checkup, and I had Eric with me. We got ready to leave, and the doctor was watching him, and he said, "By chance, have you had Eric checked?" And I said, "Well, why?" He goes, "Well, he walks kind of funny, and there may be something wrong with his hips." So it's okay. So we made an appointment with an orthopedic surgeon from our local children's hospital. We noticed they were really squeezing his legs and stuff, and
So they're concerned about his muscle tone.
yeah, and you could see kind of a concerned look on his face, and he mentioned, well, maybe you need to see a neuromuscular specialist or a neurologist. We met with the neurologist, and he looked at us and said, Eric has Duchenne's muscular dystrophy. By the time he's in his late teens, he's going to have a steel rod in his spine, and by the time he's 20 or early 20s, he's going to be dead.
Wow.
And and my wife's bawling, my son's bawling, I'm probably bawling at the time.
Devastating news.
We had gone from possibly having maybe something wrong with the way he walked to now being told that he was going to be dead by the time he was probably 20 years old. We had a follow-up appointment with the doctor and told her what happened, and she goes, let's follow a path and let's do the testing. Walking on his tiptoes was from his heel cords tightening. So we went ahead and we did the heel cord lengthening surgery and the muscle biopsy, sent the biopsy off. And so when we got that, and she said it's Pompe disease, which she had heard about it because she had treated a patient earlier that had passed away.
Did she give you a sense of the prognosis?
She couldn't really give us a clear sense of the prognosis, but it still shortened his life.
How is Eric's health now?
Eric is fairly healthy now. Since the time he was diagnosed until now, there have been options that have come along to help him deal with Pompe disease. I think having the continuity of the parents there with him, nobody's going to take care of him better than, I would say, one of us.
I assume he is wheelchair dependent. So
He's wheelchair dependent.
is he homebound or does he get out?
Oh, he gets out quite a bit. He loves the mountains. He loves the ocean. We make a trip to the mountains probably once every couple weeks.
So considering all the challenges that you've had, both financially and medically with the care of Eric, I suspect that you have pretty good insight about what other families might go through. And is that what led you to form the United Pom-PAY Foundation?
There was a thought that maybe there was something we could do to help other patients that are facing this or will be facing this. When I decided I was going to stay home and take care of Eric, we had dealt with a lot of these issues. And so in 2002, we started the United Pom-PAY Foundation to offer financial assistance, information. We can help patients that are just learning how to deal with this, whether they have children with Pompe or spouse with Pompe, or maybe it's just theirself with Pompe. We try to become a resource for them to do that.
Well, thank you so much for sharing your story and Eric's story, and for the advocacy and leadership you provided to the Pompe community, which allows everyone to learn from each other and improve the outcomes long term for people affected by this disease. Again, thank you for participating in the show.
Thank you.
Wow. Tiffany, David, Eric's story, so very inspirational. For more information about Pompe disease, please visit our website at accesshealth.tv.
Well, thanks to rare disease specialist Dr. Barry Byrne, we now know what Pompe disease is. And thanks to our incredible patient advocates, Tiffany and David, we know what it's like to live with this rare, life-threatening disease. Dr. Holmes, Dr. Byrne, I was so touched and moved by the patient advocates and their stories and how open they were.
Yeah, you know, I agree with you, especially the amount of effort they're putting into raising awareness and supporting other patients despite their own diagnosis. But Dr. Byrne, I'm interested in knowing what led you to managing Pompe disease.
Well, my clinical training is in pediatric cardiology, and as we talked about, the most severe patients have a form of heart failure that presents early in life, and that's what led us to really look carefully at this problem and try to understand it more thoroughly.
Now, earlier you described a test, that there's a test for this condition. Tell us more about it.
Well, there are tests that can be done in adults, a blood spot test specifically for Pompe disease. There are also panels of genetic tests which are becoming available that will look at a variety of related conditions. And there's now a recommendation to screen all newborns for the severe form of the disease in the first days of life.
What can doctors and patients do to come to an earlier diagnosis?
Well, we talked about recognition of some of the screening laboratory tests that point towards neuromuscular conditions. And also, of course, patients can be their own advocates. And there are several patient support or patient advocacy groups to maintain that community of knowledge that the patients share among them. And that helps identify ways that they can help manage their disease for their lifetime.
And I hope that we give the tools to patients to sort of be able to better manage their disease. And of course, we wish the very best to the patient advocates, Tiffany and David. And don't forget that you can log on to accesshealth.tv for all the resources you need on Pompe disease. We're so lucky to have had Dr. Barry Byrne on our show today.
Yeah, definitely.
But also really to hear the patient's journey, to see how far they had to go in order to get a proper diagnosis. It's really incredible.
Well, especially since many of the symptoms are shared by so many other conditions, and it makes it very difficult to diagnose it.
Now that we've given it exposure on our show, maybe it'll be on more people's radar. I think that's great.
For more information, visit our website, accesshealth.tv, and follow us on Facebook. So on behalf of Dr. Dennis Holmes, Janet Zapala, Dave Sinclair, and myself, Erica Vetrini, we'll see you next time on Access Health.
We've been talking about muscle building and muscle repairing foods. Well, I have to tell you, if you take a look, this table spells good health. Let's start with salmon. Chock full of protein, great for muscle building and muscle repair, and not too far behind when it comes to omega-3 fatty acids. Eggs, chock full of protein, vitamin D, love these. Sweet potatoes, a wonderful form of complex carbohydrates, and legumes like lentils. They're really, really high in protein, great for muscle building and muscle repair. Nuts, all kinds of nuts, walnuts, hazelnuts, almonds, great source of dietary fiber. You know, apples, what do the doctors say? Eat an apple a day keeps the doctor away. They're also a great source of carbohydrates. And what do Popeye say? You have to have your spinach, right? For muscles and for calcium, great for bone health. And last but not least, extra virgin olive oil, an excellent source of good fats. So make sure you eat these kinds of foods every single day. Take care of your body. Your body will then take care of you.